Hi everyone, in this video I am going to discuss about pulmonary angiogram. I am Julian K. Thomas, faculty working in Triple M College of Nursing. The objectives of this discussion include the group should be able to define pulmonary angiography, list down the indications and contraindications of pulmonary angiography, brief the nurse's responsibility in pulmonary angiography, enumerate the complications of pulmonary angiography. Angiogram. What is an angiogram? So angiogram is an imaging test which uses the X-rays to produce the route map of the body's blood vessels. So dyes will be injected and we can take several X-rays to see the inside of the blood vessel. That is an angiogram. So using this test we can use to study narrow, blocked, enlarged or malformed arteries or veins in many parts of the body including our brain, heart, abdomen and the legs. When the arteries is studied, it is known as arteriogram, or if the vein is studied, it is known as venogram. So based on which type of blood vessel is studied, the name varies. If we are going to study the inside of the artery, it is known as an arteriogram. If we are going to study the inside of a vein, it is known as a venogram. Pulmonary angiogram. So what is a pulmonary angiogram? Pulmonary angiogram is an angiogram of the blood vessels of the lungs. So by using the pulmonary angiogram, we can visualize the inside of the blood vessels in the lungs. So this angiography is performed to measure the pressure of the lungs. The pulmonary pressure means it is the pressure of the blood vessels carrying blood to the lungs. Even we can evaluate for any blockages or narrowing of these blood vessels in the lungs, for example, a blood clot. The common one we can identify in the lungs is the pulmonary embolism. So this pulmonary angiogram is a gold standard for diagnosis of pulmonary embolism or any clot in the pulmonary blood vessels. Pulmonary angiogram is usually done through an injection of a radiographic contrast material into the pulmonary arteries and the pulmonary angiography which permits the visualization of the pulmonary vasculature. So initially a dye is injected into the blood vessels through the femoral vein. So through that we can visualize the pulmonary artery using the dye. So if when a congenital embolism is suspected, initially a lung scanning should be done. Once the lung scanning is normal, then the pulmonary embolism should be ruled out first. Indications for pulmonary angiography. What are some of the indications or when we have to do a pulmonary angiogram for a patient? So the first one is to detect any pulmonary embolism or any clot in the pulmonary vasculature. Either it can be a congenital or acquired lesions that can lead to pulmonary embolism. So to rule out the pulmonary embolism or to find out whether it is a congenital or acquired one. So for that pulmonary angiogram can be done. The second one is to check the blood flow to the lungs before or after any main surgery. Check for and treat a blood clot. That is the main one is the pulmonary embolism. So as we discussed earlier, so this is a gold standard in diagnosing pulmonary embolism for a patient. That is pulmonary angiogram. Then to treat cancer or bleeding in lungs, then bulging blood vessels. So any aneurysm which is present in the pulmonary vasculature can be identified with the help of pulmonary angiogram. Then an artery abnormally connected to a vein, that is arteriovenous malformation is there in the pulmonary vasculature. It can be easily ruled out with the help of pulmonary angiogram. Heart and blood vessel problem present at the birth, that is any congenital anomalies of the heart as well as the blood vessels of the lungs can be identified with the help of pulmonary angiogram. Then any foreign body in a blood vessels or narrowing or stenosis of the blood vessel wall of the pulmonary vasculature. These are some of the indications of pulmonary angiogram. Contraindications for pulmonary angiogram. The contraindications for pulmonary angiogram include if the client or the patient is allergic to shellfish or iodinated dye, or the clients who are pregnant. When the pregnant woman there, unless the benefits outweigh the risk, pregnant women are contraindicated for pulmonary angiogram. Clients with any bleeding disorders. So these are some of the contraindications for undergoing pulmonary angiogram. Client preparation for pulmonary angiogram. So how to prepare the patient for pulmonary angiogram? First, explain the procedure to the patient. So, what is the procedure? How the procedure will be? That should be clearly explained to the patient. Obtain informed consent from the patient. The doctor in charge should be explain the procedure to the patient, and the nurse make sure that the signature has been obtained in the informed consent. Then inform the client that a warm flush will be felt when the dye is injected. So when they inject the dye into the vein, so the patient will feel a warm flush, so that is normal, so that need to be informed to the patient. Check the patient for any allergies to iodinated dyes and shellfish. If the patient is allergic, that patient will be contraindicated for the procedure. So determine if the patient has any ventricular arrhythmias. Keep the patient in NPO, nil per oral, after the midnight on the test. Administer any pre-procedural medications as ordered by the physician. Usually atropine will be given to decrease the secretions in the respiratory tract. Then mepridine may be used for sedation and relaxation. So we have to instruct the patient to stop any medications. If the physician has ordered, that medication should be stopped before the procedure. Usually the blood thinning agents, if the patient is taking, usually 3 days prior or 1 week prior, based on the physician's order, it will be stopped. So if the physician advice for any medications to be stopped, that should be stopped prior to the procedure. Procedure. So, during the pulmonary angiogram, the client will be placed on an X-ray table in the supine position. The electrocardiography electrodes will be attached for the continuous cardiac monitoring. The patient will be monitored throughout the procedure. The catheter should be placed into the femoral vein and passed into the inferior vena cava. So, with the fluoroscopic visualization, the catheter should be advanced to the right atrium and to the right ventricle. Then it will enters into the pulmonary vasculature. So the catheter is manipulated into the pulmonary artery where the dye is injected. So a clear visualization of the pulmonary vasculature will be obtained. So several X-ray films of the chest are immediately taken in timed sequence. So this allow all vessels to be visualized by the injection to be photographed. If filling defects are seen in between in the contrast filled vessels, we can suspect pulmonary emboli. So if filling defects are seen in the contrast filled vessels, pulmonary emboli are present. Or if we want to see the bronchial artery, then the femoral artery should be cannulated instead of the vein. So during the injection of the dye, we should inform the patient that the patient will feel a warm flush when the dye is injected. So once the procedure is done, once the angiogram or visualization of the pulmonary vasculature is done, once the procedure is over, what is the post-procedural care should be given for the patient? Observe the catheter insertion site for any inflammation, any hemorrhage or any hematoma. Assess the client vital signs. For any evidence of bleeding can be assessed from the vital signs. So clearly monitor the client's vital signs, that is decreased blood pressure or increased pulse. Then apply a cold compress to the puncture site if needed to reduce swelling and discomfort. And we should apply a tight padding over the puncture site. Inform the client that coughing may occur after this study. That is normal. Then educate the client regarding the need for bed rest for 12 to 24 hours after the rest. So we have to constantly and thoroughly monitor the patient for any bleeding, and also we should clearly monitor the vital signs of the patients, and the site should be punctured with tight sealing. Precautions before the procedure. So what are some of the precautions we have to take if the patient is pregnant or may be pregnant, suspecting a pregnant? We should not do an angiography for the patient. If the patient is allergic to contrast dye or iodine, or if the patient is having any kidney failure or other kidney problems, because the dye which is injected should be removed through the kidney. So we have to see for any kidney problem for the patient. If the patient is sensitive to or allergic to any medicines or latex, tape or any anesthetic medication, so take any medications including prescription, that is over the counter medications. If the patient is taking, the patient should be little bit alert when the patient go for pulmonary angiogram. Or if the patient is having a bleeding disorder, or if the patient take any blood thinning medications like anticoagulants, aspirin or any other medications which affect the blood clotting, so these patients should be little bit precautious before doing pulmonary angiogram. What are some of the complications associated with pulmonary angiogram? So the complications we can suspect after a pulmonary angiogram: allergic reactions to iodinated dye, hypoglycemia or acidosis can happen to the patients because the patient, those who are taking metformin and receive an iodine dye, there is a sudden hypoglycemia or acidosis can happen to the patient. Or cardiac arrhythmia, premature ventricular contractions during the right-sided heart catheterization may lead to ventricular tachycardia and ventricular fibrillation. So when we are inserting the catheter to the through the femoral vein into the right ventricle and then to the right ventricle, there are chances of cardiac dysarrhythmias. Then bleeding due to the puncture of a blood vessels or injury to the nerves, clot or embolus in a blood vessel, an area of swelling due to blood buildup of the blood, that is the hematoma formation in the puncture site, or an infection or exposure to radiation. So these are some of the complications associated with pulmonary angiogram. After pulmonary angiogram, when the patient should be conscious or when the patient should seek medical help. If the patient is having fever of 104 Fahrenheit or higher, or sometimes the physician will say some level. So if the patient is having continuous fever or any redness or swelling of the groin or the arm site, or a lot of blood at the groin or arm site, or if the patient feel any pain, coolness, numbness or tingling sensation, or loss of function of the arm or leg. So any of these condition persists, the patient should seek medical help immediately. So to conclude about pulmonary angiogram is an essential tool for clinicians and healthcare providers treating patients with lung disease. Pulmonary angiogram is a safe procedure for the majority of patients and useful tool for both diagnostic and therapeutic purposes. The patient will require monitoring before, during and following the procedure. The nurse must look for any changes in breathing pattern, chest pain or any other signs of discomfort. The complications occurred were minor and self-limiting. Appropriate preparation and close supervision and adherence to the protocol were essential for a successful and safe procedure. These are the references. Thank you.